Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, greetings of virtue, may peace be upon us all. Hi everyone, let me introduce myself. My name is Cindy Febrianita Rahayu. I am a student from Stikep PPNI West Java with student number 222007 from class 2A. On this occasion, I would like to thanks to Mr. Rizal Ilbert, SSMM, who has given me this assignment. I submitted this assignment for my best learning project assignment from an English course. Everyone, this time I will explain a little material about hypertension. Does anyone know why hypertension is called the silent killer? Hypertension is often called the silent killer because it often goes without complaints, so sufferers do not know that they have hypertension, but then find that they already have a disease or complication from hypertension. To find out more about hypertension, let's watch the video. Everyone, in this video, I will discuss about the first definition of hypertension. Second, classification of hypertension. Third, cause of hypertension. Number 4, symptoms of hypertension. Then diagnosis, nursing diagnosis of hypertension, and solution, how to prevent control of hypertension. The first is definition, namely definition of hypertension. What is hypertension? Does anyone know what hypertension is? High blood pressure or hypertension is an increase in blood pressure in the arteries. In general, hypertension is a condition with those symptoms where the pressure is high. Abnormally high levels in the arteries cause an increased risk of stroke, aneurysm, heart failure, heart attack, and kidney damage. When checking your blood pressure, we'll get two numbers. Higher numbers are obtained when the heart contracts or systole. A lower number is obtained at heart rate relax or diastolic. When is blood called hypertension? It is said to be high blood pressure if when sitting the systolic pressure reaches 140 mmHg more or diastolic pressure reaches 90 mmHg or more or both. In high blood pressure, there is usually an increase in systolic and diastolic pressure. Secondly, there is classification, namely classification of hypertension. Classification of blood pressure in adults. Category systolic blood pressure, diastolic blood pressure. The first, normal below 130 mmHg, below 85 mmHg. Secondly, normal high 130 to 139 mmHg and 85 to 89 mmHg or stage 1. Third, mild hypertension 140 mmHg to 159 mmHg and 90 to 99 mmHg or stage 2. The fourth, moderate hypertension 160 to 179 mmHg and 100 to 109 mmHg or stage 3. Then severe hypertension 180 80 to 209 mmHg and 110 to 119 mmHg or stage 4. And let's malignant hypertension 210 mmHg more and 120 mmHg or more. Types of hypertension. Several types of hypertension that need to know are the first, primary hypertension or essential. This type of hypertension will appear gradually over the years. The cause itself is due to genetic factors or an unhealthy lifestyle that a person lives. Secondly, secondary hypertension. Secondary hypertension is a type of high blood pressure that occurs due to other medical condition that the sufferer experiences. This condition tends to appear suddenly and causes blood pressure to spike. Third, prehypertension. Prehypertension is a health condition that occurs when blood pressure is higher than normal. Prehypertension is a condition when blood pressure is between 120 80 mmHg and 140 90 mmHg. The fourth, hypertensive crisis. Hypertensive crisis is a type of hypertension that has reached a severe stage, namely if blood pressure reaches 180, 120 mmHg or more. In a hypertensive crisis, it can usually cause damage to the blood vessels, causing bleeding, or it can also cause a stroke. The five, hypertensive urgency. When hypertensive urgency occurs, the severe blood pressure will be very high, more than 180, 120 mmHg, but there has not been any damage to the organs in the body. And the last, hypertension emergency. Hypertension emergency is a condition that occurs when blood pressure is very high and has caused damage to the body's organs. Usually, this type of hypertension can cause dangerous complications such as death. Third is cause, namely cause of hypertension. Causes of hypertension. In general, the causes of hypertension are: the first is genetic or hereditary factors. One of the causes of hypertension called the genetic or hereditary factors. Second is physical change. Physical change with aging can also be a cause of hypertension. Third is unhealthy lifestyle. Lifestyle choices are the most common cause of hypertension. For example, smoking habits, consuming too much salty and sweet food, and lack of physical activity. Lastly, the presence of certain medical conditions. Certain medical conditions can cause hypertension to appear, such as having a history of kidney disease, side effects from the medication consumed, having congenital heart defects, consuming excessive alcohol, and so on. 40 are symptoms. Symptoms of hypertension. Symptoms of hypertension. According to World Health Organization or WHO, people high blood pressure or hypertension can experience symptoms including severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, confusion, buzzing in the ears, nosebleeds, and abnormal heart rhythm. The fifth is a diagnosis, meaning nursing diagnosis of hypertension. Nursing diagnosis. One of the nursing diagnoses that arise in hypertensive patients is a decrease in cardiac output. From the nursing diagnosis, a nursing care action plan can be prepared to reduce blood pressure in hypertensive patients. Nursing problems. Nursing problems that will arise due to hypertension are acute pain, decreased cardiac output, excess fluid volume, ineffective coughing, activity intolerance, risk of ineffective brain tissue perfusion, risk of injury, knowledge, and anxiety. The last material is solution, how to prevent and control of hypertension. How to prevent of hypertension? Efforts that can be made to prevent hypertension are regular health checks, get rid of cigarette smoke, regular physical activity, balanced diet, get enough rest, and manage stress. How to control of hypertension? If someone has experienced various symptoms of hypertension or is already suffering from hypertension, it is important for the sufferer to control hypertension by check your health regularly and follow the doctor's recommendations. Treat the disease with appropriate and regular treatment. Stick to a diet with balanced nutrition. Strive for safe physical activity, avoid cigarette smoke, alcohol, and other carcinogenic substances. With efforts to prevent and control hypertension, it is hoped that we will know the condition of our blood pressure through regular health checks, and for hypertension sufferers, treatment and care can be carried out immediately before complications arise. Public Health Office. There is a quote from one of the famous figures, namely John Billings, who said, "Health is like money. We never have a true idea of its value until we lose it." So my explanation is that I asked if the extract I conveyed is inappropriate and there is something wrong with my pronunciation. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh. Stay healthy, everyone.